Hello, welcome to the Frank and Lizzie Show. We're excited today because we have a piece of technology that can help change your practice. So today, I'm Frank Avales, your co-host, and with me we have...
Hi, I'm Lizzies Thoughts. How are you? I'm a nurse practitioner from Pennsylvania. We're here today to meet with a friend of mine, or I guess a new friend of mine who I recently met and worked with. And I'm so excited to bring her on. We can kindly welcome Dr. Naz Wahab to the show.
Hey, welcome.
She is a primary care physician by training, but for the last 19 years has been a wound care and hyperbaric specialist. She works out of Las Vegas, Nevada. And here we're going to talk to you today about SNAPshot by Kent Imaging.
And I'm so excited to have Dr. Wahab with us today. Now, we are looking at the SNAPshot NIR, which is a handheld image device that captures tissue oxygenation. It captures the microvascular oxygen. Now, keep in mind that this is not thermography. It doesn't capture temperature. It's strictly microcirculation. So with this point and shoot action, we want to hear more about it.
All right, so I'm glad you're here. Can you tell us about this technology?
Yes, so we have this Kent SNAPshot. It is a near infrared camera. And so it's actually being able to take images of wounds by just a very mobile device and showing the actual vasculature and tissue perfusion of the wound and the surrounding wound itself.
So is this a form of photography?
Yeah, in a way, it's definitely imaging, and so it's much more than photography. Although when you actually see some of the images, you'll be able to see, you can see a regular photographic image of the patient. Then you can actually do measurements, and also see tissue perfusion. And then it further breaks it down into showing you what oxygen versus deoxygenated blood flow is to that area as well.
In real time.
Yes, in real time.
That's awesome.
So can you show us what the device looks like?
Yeah, actually, we can see this is sort of the device from the back side, and this is what you would be seeing on the image side that you and I would be seeing as practitioners. And so it's very interesting, very fantastic technology, because it's really important to be able to utilize this to develop an algorithmic plan of how I'm going to treat this patient and what's working and what's not working. So it's been fantastic in our practice.
Well, let me start with asking you, can you walk us through how you're using this technology in your clinic?
Yeah, so let's just say, for example, we have a patient who's had a amputation. And unfortunately, the amputation site is now becoming black, an eschar is developing, and I think many of us have seen where surgeons will say, it's fine, nothing's leaking, everything is fine, but then some of us who are the wound specialists are thinking, that's not fine, I don't know if it's really healing. And it is very deceptive. And so being able to take a picture and an image of that area to actually gauge tissue perfusion gives me an idea of, is that black eschar simply dried blood, dried exudate, or is it really a black eschar in which there's not enough perfusion and that area is going to be non-healing? So it actually helps with predictive values, and then also helps you in what portion of that wound is going to heal and not going to heal, at least by imaging and what we're seeing as far as tissue perfusion.
It seems like this would be like really clutch as part of your initial evaluation, because I know when we see patients, you don't know what studies they've already had done sometimes, or what the previous physician, particularly with an amputation, if they're coming from an outside facility. And this is like in your hands, in the moment.
Right. And so majority of our patients obviously have already gone to the hospital. They've already had a workup, hopefully. And a lot of times they come back saying nothing can be done. And so
Hmm.
now you go to the wound specialist. I think we can all attest to that, right? And so I think at that portion, at that point in time, again, you can do angiograms out the wazoo and you can get all of this information, but it really doesn't translate always into the angiosomes, and it doesn't translate into that actual wound and just that surgical line. Where is it going to heal and where is it not going to heal? And how much tissue loss are we really going to have? And so, and we've also been using it. So in this particular patient, we can get an idea of if there's an area that is poorly perfused, and if so, would this patient benefit from hyperbarics? And so it is definitely driving my decision making into saying, is the patient a viable candidate for hyperbarics? And then on top of that, we go on and we can actually, let's say there is going to be significant tissue loss, despite great wound care, despite hyperbarics, etc., then can we use this to help the surgeon with reconstructive surgery? Maybe another flap needs to be performed, maybe more tissue needs to be brought up, and is this going to be, again, a viable surgical option?
Lizzie, this would be great, I think, because now we can not only predict, but we can also follow to see if we're on the right track with patients.
Yeah, I mean, I feel like this is really changing how we practice, but from an operational standpoint, how hard is it to use the device, or like, is there other things associated with it? Like, how does the device actually work? You just take a picture?
Yeah, so the big thing is you do need to make sure it's charged. I know that sounds very simplistic, but when you have a very busy clinic and you're going all day long, you do need to make sure it's charged. The other thing you need to make sure is that you actually have your staff trained, and the training is not that intense, but when you're actually taking images, you'll see kind of red laser beams coming off of the back of this, and then you actually aim and point and click, and the image is taken. So it takes just a matter of seconds. You can take multiple images of the patient. And again, when you're taking the images, you're really looking at an angiosome. I think that the concept of angiosomes has been gone by the wayside, and I think it's really important. Is this area able to be perfused enough to heal the wound? So that all, and then we've trained our staff to be able to also image along those angiosomes, so that would be very helpful for us as the clinicians to make interpretations.
Wow, that's awesome. And then it stores on the device, and does it integrate with like your electronic health record, or?
Yeah, so it does store in the device. You can actually download the image to a USB. There are integrations now with some EMRs that you can actually, the image can be downloaded to your EMR directly, and it's inside of the record. Also, the device itself, you can email a report to a consultant. So if your surgeon or another wound specialist who may not have the device needs to have this information, you can actually take the picture, email it in a report form directly from the device. And it's just extremely easy, helpful, and your consultants are very, very appreciative.
Yeah, that sounds great.
Yeah, I took the liberty earlier to look at the website, Kent's website, and I was amazed to see you not only, you talked about part of what they're using it for, they have reports on a lot of things. And I did find a study that showed that if you get below the certain level, then you have issues with perfusion. So I can't wait. I can't wait to see what else you're coming out with this machine.
Yeah. So, and I think, like, to your point, Frank, I also visited the website because, of course, I'm a geek and I love new technology. But it showed that like the tissue oxygenation saturation was a key indicator of the tissue health, but like that the NIR light actually penetrates deeper than the other lights that are out there, and it's like around like 2 to 3 millimeters into the tissue. So it's really like the microcirculation that like our vascular studies may not pick up on, and that's actually where our wounds are, is in the microcirculation, not in the vessels. So I just think it's brilliant technology.
Yeah, and to the point, because it's this very small spectrum of this near infrared, it also helps with any melanin pigmentation. The algorithm that they're using on here helps to correct for darker complected individuals versus lighter complected individuals. And so I think that that's very important, because again, there's a lot of health disparities, based on ethnicities and things like that. And I think technologies like these are very important to recognize that and deal with those types of healthcare disparities. The other thing, just to let you guys know what we're using it for too, is that, skin tissue biologics are so expensive. And, as we know that insurance companies are balking at us on why we're using them. And we as practitioners say we really need them. And so this gives great imaging to explain how we can use the technology before application of a tissue biologic, and then after week 1, week 2, week 3, etc. You can actually visually see the increase of tissue perfusion. And it's great. I've used it to justify to medical directors, insurance companies, on why we are using those biologics and how we know that they're expensive, but that they're probably worth their time. So,
now, could you show us some case studies using this device or some images?
Yes, so you can see here we have a patient who underwent a transmetatarsal amputation. And you can see the image itself is just one big, large black eschar, and you can't really understand or tell what's viable and what's not viable there. So we move on to take an actual snapshot. And you can see, unfortunately, this might be a little bit dark, but again, this is all one big black eschar, and then we have the imaging here. And like I mentioned before, red is the best type of perfusion, and orange. And then once you get into the blue, that's a little bit less oxygenated. So you can see that there's an area that's lit up here that's blue on the superior aspect of this image. Yes, so now here we actually can click on the touch screen and show the oxygenation to those areas. And so as you can see on the inferior aspect of this picture, you can see that 69, 62, 67, 68%, those are all decently perfused. I'm not saying that that's 100%, but the likelihood of those areas healing with good aggressive wound care is probably fairly likely. There's the area on the superior aspect of only 25%. And you can see that that's a significant portion of the wound as well. And that's going to be perfused by another angiosome also. So this patient likely will have a significant deficit of healing along that surgical line. So this person would likely benefit from hyperbarics. Now you can see here, we have another image where you can see the total tissue oxygenation in the top left-hand corner. The bottom left-hand corner, that's the total hemoglobin view. That's oxygenated hemoglobin. And then the top right-hand is the deoxygenated hemoglobin. And then the right lower aspect is the oxyhemoglobin. So again, it breaks it down into, is it really oxygenated versus deoxygenated blood that we're actually seeing. And so I think, again, it's important to see what portions are likely going to heal, what portions are not going to heal.
That's awesome. This is really a game changer, I think, for everybody. This is amazing technology. I love the pictures. Love, love, love. And I'm sure, the patients and insurance companies do too.
Yes, I think it's just so needed. And also, again, like we mentioned, in some of these areas, it might be a viable option to also put tissue biologics over the area and see if that will impact the tissue perfusion as well. So again, utilizing expensive modalities can be justified with this machine.
Yeah, it seems like it would really change your decision making in real time instead of having lots of hypothetical conversations with the patient and then sending them for more studies.
Right.
Great.
Yeah.
Right.
Not just that,
Huh?
but you can also probably start interventions a lot faster. We talk about clinicians being slow at doing advanced modalities or advanced products. Well, now we have technology to guide us in the right direction.
For sure.
I like it.
So the interesting thing is off of that entire surgical line and that flap, majority of that will probably heal. This gentleman probably has enough oxygenation for those areas, but because that area of 25% is likely not going to heal, he might be an excellent candidate for hyperbarics. He's already been vascularly reperfused with endovascular procedures. He's already had all of the workup, etc., and nothing further really can be done. And so this person is probably an excellent candidate to go into hyperbarics and probably would have a very good outcome as well.
I like that. And what I like, Lizzie, is that it gives it to you within seconds. And that a lot of facilities that I've seen across the country, they don't have the non-invasive equipment. So this one would be valuable. I'm thinking, my mind's thinking of other things I could use this on in the hospital.
Yeah, that's great. And it's nice there's no injectable. I know there's other technologies that utilize injectables or, it's like a per charge thing. And this sounds like it's, right in your pocket. I like things that are already in your toolbox that you can just pull out when you need them and really just give you that objective data that I think all of our payers are really looking for nowadays. I think this is ahead of the curve. So this is great.
Yeah.
Wonderful.
Yeah. I do want to add something,
Yep.
A lot of the times when I get consulted all over, if I have a visual, it makes a big difference whether we get that patient taken care of quicker or not. So
Yeah.
This is more than I think. This is more of objectively look at it. So thank you for sharing that with us, Dr. Wahab.
No problem. Yeah, and it's been great for the patients as well when they can actually visually see that they're healing on a microscopic level. I mean, it's just it's a game changer for them. We actually have patient buy-in, so it helps with compliance as well.
Oh, that's a game changer for sure. For sure. Well, great. Well, thank you so much for coming on the show today. This is great. I can't wait to hear more about it. We'll be sure to include the link for the Kent Imaging SNAPshot in the description of the video. So if you want to learn more, see the case studies, learn more about the technology, or speak with a representative, you can absolutely do that on the website. Frank, anything else to share?
Yes, actually, for everybody watching this, I'm going to get to see Lizzie in person in February. You want to tell them where, Lizzie?
Yeah, we're going to be at Wound Week in Philadelphia. It's February 24th through the 27th. We are looking forward to it. Be sure to find out more details at the apwca.org website. Save the date.
Yes, and we're promoting multidisciplinary teamwork. So if you're a therapist, if you're a dietitian, anybody, come join us.
Yes, please do. So, Dr. Wahab, thank you so much for joining us today. We really appreciate all your knowledge, and we look forward to hearing more about this technology moving forward.
Great. Thank you so much. I appreciate it.